Today is World AIDS Day, and the World Health Organization is standing shoulder to shoulder with partners and communities around the globe, calling on leaders and citizens to champion the fundamental right to health. This year's theme, Take the Right Path, My Health, My Right, is a rallying cry for accessible, rights-based healthcare that empowers people living with HIV to lead vibrant and fulfilling lives. Dr. Temitope Ilori is the Director General, National Agency for the Control of AIDS. She joins me live on the news for more on this. Good to have you join us, Doc. How exactly is Nigeria faring in meeting the 95-95-95 target of testing, treatment, and HIV suppression?
Thank you very much. Good afternoon, Nigerians. Yes, happy World AIDS Day. I would say that we're doing pretty well. We are on track, let me say it that way. We've made significant progress, looking back from where we're coming from. At the time, we had prevalence of HIV/AIDS in the general population as high as 3.6, 3.9. Now, as of today, about 1.4% of Nigerians are living with HIV/AIDS, and that's approximately about 2 million Nigerians are living with HIV/AIDS. About 1.6 million of them are on antiretroviral medications, and that transmits about 85% of the vulnerable population, estimated vulnerable population, actually on antiretroviral drugs. And that is a significant improvement from years back. However, we believe that we need to do better to be able to achieve the global target of 95%, which is the global target. And that is why this year's theme says, take the right path. Right in this regard means human rights, that nobody should be left behind. Everybody, every vulnerable individual should have access, to HIV testing and screening, to HIV counseling, and to HIV treatment, be it a child, be it a woman, a pregnant woman, be it an adult, or whatever gender or race or, vulnerability should have access. So the services should be provided and should be accessible, should be affordable. I'm glad to say that as of today, yes, HIV testing and counseling, HIV treatment, drugs are actually free in all our public government-owned facilities.
All right, Doc. Let's talk about mother-to-child transmission. Children are, a very significant vulnerable group. What is the latest statistics, in this regard? And what really are the major challenges to effectively implementing the prevention of mother-to-child transmission?
Unfortunately, I would tell you that Nigeria has the highest burden of children born with HIV/AIDS as we speak. We contribute about 25% to the global burden of children born with HIV/AIDS. And that is because our mother-to-child transmission program is not optimal as we speak. Just about 35% of pregnant women, access care, HIV services and treatment. And that is actually a multi-sectorial problem because it shows that about 63%, only about 63% of our pregnant women actually access antenatal care, ANC. About 23% of them actually deliver babies at home. And that is why I said it's a multi-sectorial problem. And that is why we want to create this awareness and to appeal to every Nigerian, particularly our religious leaders, our traditional leaders, the media, to help sensitize women to actually go to health facilities where we have trained birth attendants that can actually help assist them to deliver safely, and that they should go for antenatal care where they can be screened for HIV disease and where they can be put on treatment if necessary, if tested positive. Like I said, unfortunately, we have about 160,000 children aged 0 to 14 living with HIV in Nigeria as we speak. About just year 2023, about 15,000 children died of AIDS-related death. And that is very worrisome to us. And that is why it's part of our slogan for this year to say, no child should be born HIV. And we all have to do this collectively.
All right, Doc. And considering that funding is reducing globally, what strategies is NACA adopting to be able to effectively implement, your policy program on prevention of mother-to-child transmission of HIV?
Thank you. Yes, we are already advocating for more budgetary allocation. We are in talk with the National Assembly. We are in talk with the Ministry of Budget. We are in talk with the Office of the DG Budget, Office of the Budget. And I can tell you that we're having good results. We are also talking to the subnational, because HIV is not something that we can do only at the national level. We have the State Agency for the Control of AIDS. We have the Local Government Agency for the Control of AIDS. Particularly now that local government is getting autonomy, we are appealing to the local government chairmen all over the 774 wards in the Federation to actually allocate and mobilize resources to the care of HIV. And ditto for the governors, the state governors. Actually, a few months back, the Honorable Minister for Health actually inaugurated what we refer to as Acceleration Plan Committee in the area of mother-to-child transmission. And the whole essence of the committee is to oversight, the reduction and the elimination of mother-to-child transmission of HIV. It's a multi-sectorial committee. We are working with sister agencies in the Ministry of Education, in the Ministry of Environment, in the Ministry of Women Affairs, Gender Rights Commission, and so many others. And we are also, talking to our governors, at the various state government.
All right.
I've actually visited some states, and we have their buy-in in this.
All right, Doc. It's good to hear about what NACA is doing in all of this. Director General, National Agency for the Control of AIDS, Dr. Temitope Ilori, thank you so much for talking to us.
Thank you.